My name is Wendy McCormick. I'm the triage nurse here at Advanced OB-GYN. And I had the FemTouch procedure, first one started in December of 2017. I feel great. I had noticed the first symptoms after the birth of my last child 11 years ago. And I was having stress urinary incontinence and frequent UTIs. And so every time I watched a sporting event or coughed or sneezed, I would leak urine all over myself. And it was pretty embarrassing being in public and having to deal with that. And trying to work out in the gym, and you have to go change clothes halfway through because you've got urine everywhere. So when Dr. Salter brought FemTouch to the office, I said, let me try. And it was so easy. I didn't know what to expect with the first procedure because I've never had it done, obviously, so I didn't know what it was going to feel like, if it was going to hurt. I didn't feel a thing during the procedure. There was a couple of instances of just a little pinprick sensation when they did the labial rejuvenation, but it was so simple and easy. It was over and done in a few minutes, and afterwards it just had a little bit of minor irritation, like itching, that was easily resolved with zinc oxide ointment, and but no pain whatsoever afterwards, and results have been great. I noticed them the first time within a couple of weeks of the procedure. Was watching a Cowboys game and was screaming and yelling and jumping up and down, and had no problem whatsoever, and so it's been great. It was about 2 weeks after the first treatment that I noticed improvement. I went to a Cowboys game at the stadium with my husband, and obviously I was cheering and screaming and jumping up and down, and had no problems, no leakage whatsoever. It's also improved my vaginal lubrication and has improved my sex life because I found it's easier to orgasm afterwards, so because of the tightening of the vaginal canal. Other than working for him, he is great with his patients. He genuinely cares, and he's constantly looking for ways to improve women's lives with advanced treatments and medications and therapies. And it's great that we get to benefit as employees. So, well, I've had the vaginal rejuvenation, and I explain, it's a laser goes, inserted into the vagina, and it burns basically the entire, all the way around, coming down the vaginal canal, and it rebuilds the tissue in the vagina, and so it tightens it, it increases lubrication, it helps improve the stress incontinence because it builds that wall back up between the bladder and the vagina, and it's worked wonders. And I suffered with the stress and urinary incontinence for 11 years and haven't had any problem in 8 months now, so.